Hello, my name is Emily Vasiliv, and today we'll be discussing diversity and family factors related to autism spectrum disorder. The objective of this presentation is to discuss, identify, and define various diversities of family factors. I'll be discussing what diversity is and why it is important, as well as the topic of cultural competence. I'll also discuss how diversity and family factors relate to autism spectrum disorder. As a clinician, it's important for us to discuss these topics while providing evidence-based guidelines to use when working with families of a child with an ASD diagnosis. Before we dive into why understanding diversity and family factors within autism spectrum disorder is important while working in the field of applied behavior analysis, it is essential to understand what autism is. Autism can be discussed as a developmental disorder often characterized by social communication deficits, repetitive and restrictive interest, and some clients may also show rigidity within their daily routines. There are three different levels of severity, including level 1, needing little support, level 2, needing high support, and level 3, requiring high needs of substantial support. According to the Center for Disease Control and Prevention, in 2016, 1 in 68 children in the United States were diagnosed with autism spectrum disorder. It has also been noted that there's a higher prevalence of diagnosis of ASD in males than females. ASD also occurs in all racial, socioeconomic, and ethnic groups. Individuals with ASD may need extra support, and this is where early intensive behavioral interventions are important. These interventions are known to have significant outcomes for individuals with ASD. These interventions have shown to improve daily living, cognitive skills, and social skills, among many other things. Unfortunately, 9 in 10 children are not involved in these behavioral health services for many reasons. On the last slide, I discussed how 9 in 10 children do not receive services. We must look at the barriers to these children getting services or why they're not getting services. Furthermore, I'll discuss some disparities that may exist relating to children with an ASD diagnosis and receiving proper services. So what are disparities? Healthcare disparities are differences in access to or availability of medical facilities and services and variations in rates of disease occurrence and disabilities between population groups defined by socioeconomic characteristics such as, but not limited to, age, ethnicity, economic resources, gender, and populations. Disparities in cultural competence. According to the National Institute of Health, culturally competent care is seen as foundational for reducing disparities. This care respects diversity as well as the cultural factors that can affect healthcare, such as language, communication styles, beliefs, attitudes, and behaviors. So, what is cultural competence? This refers to involving, understanding, and appropriately responding to the combination of cultural variables and the range of dimensions and diversity that the professional and client bring to their interactions. Being aware of what cultural competence is, as well as educating ourselves as clinicians, can mean better relationships with the families and clients that we serve. It's important to note that cultural competence is a lifelong process of increasing self-awareness, developing social skills and behaviors around diversity, and gaining the ability to advocate for others. It goes beyond tolerance, which implies that one is willing to overlook differences even if you did not grow up with the same beliefs. Relating to autism, I love the quote, "If you've met one person with autism, you've only met one person with autism." I believe this encompasses how diverse this population is and not one person is the same. Moving on, we'll be discussing how family factors and diversity can affect diagnoses, interventions, and access to treatment for individuals with autism. Specifically, diversity factors including socioeconomic status, race, and ethnicity. The hope is to provide you with information on how to understand the challenges and guidelines on how to provide the best quality care for families and your clients. Taking a look at socioeconomic status, according to the American Psychological Association, socioeconomic status encompasses not only income but also educational attainment, occupational prestige, and subjective perceptions of social status and social class. This reflects quality of life attributes and opportunities afforded to people within society, or if we're looking at it from a family with a child with autism, the services that they receive, such as ABA therapy. This is a constant predictor of a vast array of behavior therapy outcomes. Numerous studies from back when autism was not as prevalent as it is now stated that children from wealthy, highly educated Caucasian families were more likely to have autism spectrum disorder. However, this research is now stating that the reason behind this belief was due to socioeconomic status and the ability to receive a diagnosis with services. At the same time, services were easier for these individuals due to higher rates of the potential to afford getting a diagnosis and attend services such as ABA therapy. According to Durkin in 2017, the United States has had a positive socioeconomic status incline in ASD prevalence with signs of increasing socioeconomic status advantage. The higher the level of socioeconomic status, the more likely individuals are to be able to obtain the necessary information and resources, such as financial, to receive an autism diagnosis. Between the years of 2000 and 2012, there's an increase in ASD diagnoses for low-income families. As clinicians, it is important that we research resources for families in our areas to provide them the best services for their child, regardless of their socioeconomic status. This is where teamwork is essential. Moving towards race and ethnicity, according to the American Psychological Association, race refers to the social construction and categorization of people based on perceived shared physical traits that result in the maintenance of a socio-political hierarchy. Self-reported race frequently varies to changing social context and individuals' possible identification with more than one race. Ethnicity, on the other hand, is a characterization of people based on having shared culture. This can include but is not limited to language, food, music, dress, values, and beliefs related to common ancestry. According to the Centers of Disease Control and Prevention, reports have consistently noted that more white children are identified to have autism spectrum disorder than Black or Hispanic children. Previous studies have shown that lack of access to healthcare services due to non-citizenship or low income and non-English primary language are potential barriers to an ASD diagnosis, especially among Hispanic children. A difference in identifying these different races and their ability to receive services may indicate that they are not getting the proper treatment to reach their full potential and get their needs met. It's also important to note that there is a lack of disclosure regarding race and ethics in research literature. As clinicians, we can implement trainings on diversity regarding race and ethnicity, be open-minded, and treat every family with respect. Diagnoses are 1.1 times more likely among white versus Black children. Diagnoses are 1.2 times more likely among white versus Hispanic children. And lastly, 1.1 times more likely among Black versus Hispanic children. As clinicians working with different people from different socioeconomic backgrounds, cultures, ethnicities, etc., we need to be inclusive by always involving and encouraging family members to be involved in the treatment process. We must avoid biases towards families and be aware of unconscious bias. We all have biases and we're not aware of, and this is a lifelong process of understanding. A way to combat our unconscious biases is to attend workshops and seminars and remind yourself that the work of identifying and lessening the impact of implicit bias may never reach an endpoint. We can also identify areas of inexperience and be honest with ourselves and the families we provide services to. It's important to ask questions and inform ourselves. We can prepare resources for families to address specific needs and remind them that we're there to help and understand to the best of our ability. It's essential to build trust with our families, and this is a great way in doing so. We must always advocate for our clients' needs, and lastly, give yourself constant reinforcement and understand that it may not always be easy. As a reminder, there are many important diversity and family factors that we should discuss and educate ourselves on. Here I provided some links to check out regarding more about what we can do to help support our families and clients. Thank you for watching my presentation on diversity and family factors.